do a trichophytic brow lift, and this is going to be really nice for her. She's also got some forehead lines, and so by doing these incisions behind the hairline, and then I go underneath in the subcutaneous layer, I separate the skin from the muscle, and that also helps quite a bit with those deep forehead lines. She's also going to get some improvement in the 11s, those funky lines between the eyebrows, because we're going to do some dissection underneath there and release those muscles that are so famous for making us look a little crabby. So our dear patient here is an educator, so it was so kind of her to let us do a little video to help educate you. So basically, I make the incision at a very beveled angle. By bevel, I mean very, very flat, and I kind of go back and forth, so it's a little slightly irregular line, and that's going to help that scar hide. We don't want a straight line. And so that is pretty cool, because that is how we get to preserve the hair follicles, and they are going to grow right through the scar and camouflage. So we do this a little bit behind her hairline. She's got a little bit of a widow's peak that's a little thin, and so I'm kind of leaving that little bridge of skin intact, and then but because I'll be able to get in underneath the central part of her eyebrow from this position. So then I'm going to use some skin hooks. Skin hooks are what I use to elevate the skin. And my longest term employee ever is helping me with this procedure, Stephanie. So she kind of knows what I need even before I say it. She's awesome. And so I'm basically dissecting up above the muscle, and I do this with a small scissor. It's going really well. There's the good thing about the face is that there's lots of blood vessels, so that is cool, because lots of vascularity means that the skin heals really well, but it also makes for a little bit more colorful surgeries. I always tease my orthopedic friends that they can just put tourniquets on everything, and of course that doesn't work out so well for me. So I get used to working in a vascular field, and it works out very well. There is, of course, an endoscopic brow lift, and that's a good option too. We go a little bit further back, and we make vertical incisions instead of these horizontal incisions. And we are able to kind of go right on top of the bone. Now there's a few little disadvantages to that, and some advantages, as there always are. The advantages would be that the scars are hidden way back in the hairline. Maybe a disadvantage would be that your hairline gets elevated. So for somebody who has a high forehead, for example, me, we always laugh that we have the Matheson 5 head instead of 4 head. So for somebody like me with a Matheson 5 head, it wouldn't look great if I elevated my hairline back even more. So I'm going to take the bipole, or the Surgitron, yes. So an endoscopic brow lift would raise that hairline. For somebody with a really low hairline, that would be ideal. And probably the endoscopic brow lift is one of the most common types of brow lifts that we do. But as I said, I kind of like this one for somebody with a higher forehead, and then also with some of those forehead lines. I am going to do a little Botox on her too to kind of relax things as things heal. But it's going to give her a nice long-lasting result to be able to, to kind of disassociate the muscle and the, thank you. There we go, good. To disassociate the muscle from the skin, of course. And then my mom was a nurse, and my mom was also an artist, so I kind of think that maybe I got kind of a nice blend of both of my parents, since I get to be an artist and a surgeon in what I do. So
at the same time.
Yeah. Yep. So as you can see, we have a really brave patient. She's awake, and we did give her a little bit of la medicine, but she is doing just great. All right, good. And I'm gonna have you get that longer scissors for me. Sure. Now I'm actually using my finger to help out a little bit. This is something we often do. So, and when we redrape, we're going to be taking out about 1.5 centimeters of skin. And once again, we're going to bevel that incision when we do that. So I'm going to put a little gauze pack in here, and then I'm going to come on the other side.